Rwanda's health institutions report that approximately 1,000 people succumb to cancer each year. The Rwanda Biomedical Center, RBC, confirms that while essential resources for cancer treatment are currently available, certain types of cancer remain without specialized care due to a lack of experts in those areas. We have the report via Olivinetti.
Cancer treatment encompasses various approaches with three primary methods: surgery, radiation therapy, and chemotherapy. The choice of treatment depends on the type and stage of cancer, with some cases requiring a combination of all three. Presently, all these treatment options are available in Rwanda. Specialized centers dedicated to cancer treatment in Rwanda include the Butaro Cancer Center of Excellence and the Rwanda Cancer Center, which is affiliated with the Rwanda Military Hospital. These centers focus exclusively on providing care for cancer patients. Colonel Dr. Pacifique Mugenzi, the head of the Rwanda Cancer Center at Rwanda Military Hospital, highlights that they have been providing cancer treatment for the past 4 years. He notes a positive change in the increasing number of people seeking treatment, attributing this to growing awareness efforts that are beginning to yield significant results.
There has been very obvious and considerable improvement over the years when it comes to cancer services in general, and we see this from policy makers to health professionals and even the population. So as far as we are concerned, I think part of that improvement has been marked by the availability of radiotherapy, a service that few years back used to be a reason for referral abroad. So now we are happy to report that we are able to provide that service in our cancer center since just over 4 years now.
Cancer treatment in Rwanda began in 2012, at a time when there was not a single Rwandan doctor specialized in this field. Today, there are 115 doctors in this field. Dr. Theonest Maniragaba, director of the cancer program at the Rwanda Biomedical Center, explains that cancer treatment services have significantly improved over the years, reflecting the country's growing capacity to address this critical health issue.
In 2013, we had our first radiology oncologist, and the following years, the Ministry of Health implemented a system to send many doctors for specialization. Currently, the number of radiology oncologists and those providing chemotherapy has increased. However, cancer treatment involves more than just medication. It also requires accurate diagnosis. Previously, we did not have histopathologists, with the first one arriving between 2014 and 2015. For the past 12 years, the Butaro Cancer Center of Excellence was the only center offering cancer treatment, and it has continued to expand its services. Radiotherapy, which was officially inaugurated in 2020, was missing in Rwanda from 2012 to 2020. Statistics show that 60% of patients needing cancer treatment require radiotherapy. In addition to specialized cancer centers, several general hospitals in Rwanda also offer both general healthcare services and cancer treatment. This includes the University Teaching Hospital of Kigali, which also has a particular focus on pediatric cancer treatment. Dr. Aimable Kanyamuhunga, a pediatric oncologist, notes that an increasing number of tools and medications are becoming available to effectively treat cancer patients.
The most challenging we had in the past, it was affordability and accessibility of cancer drugs. We had in the past surgery, have been operating patient with cancer and yet transferred to Butaro for chemotherapy. That was story now. We have good surgeon, we have chemo drug for patient that can come at say Ashika in pediatric population. And whenever we need radiotherapy, we're still relying to RMH.
Despite the availability of essential cancer treatment services across Rwanda, a significant gap remains in that these services are not yet centralized in a single facility. Currently, radiotherapy is only available at the Rwanda Cancer Center at Rwanda Military Hospital, highlighting the need for further integration of services. As a result, All patients requiring radiotherapy in Rwanda must receive treatment at the Rwanda Cancer Center, which currently accommodates between 80 to 100 patients daily. Colonel Dr. Mugenzi Pacific, the head of the center, explains that as the facility continues to develop, they aim to expand their services and acquire additional equipment to better meet the growing demand.
We started with one form of radiotherapy, which roughly translated would be radiotherapy whereby a machine would deliver the dose without touching you. But there are additional techniques that are required, especially in some female cancers, which is called brachytherapy, which now is the type of treatment that the source is put in contact with the treatment area or the patient, so to speak. So I am happy to report that we are in the process of starting that service. The construction and the procurement of the equipment is almost, it's near completion. So it's an additional service that we are proud to be able to afford to our patients. So the other one in the near future involves nuclear medicine, which is also part of the missing link so far when it comes to cancer management, which is actually one of the few reasons why we still have to refer some patients abroad.
Currently, Rwanda's community-based health insurance covers 100% of surgery costs for patients in need. However, it only covers 90% of cancer treatment costs for patients requiring radiotherapy, leaving patients responsible for the remaining 10%. This copayment is considered a significant barrier due to the high cost of treatment. Dr. Theoneste Maniragaba, director of the cancer program at the Rwanda Biomedical Center, indicates that the Rwandan government is working on measures to ensure continued care for cancer patients and ease their financial burden.
turimo turafatanya n'abo dukorana ndetse n'abafatanyabikorwa kuganira nabo.
We are collaborating with partners to explore options for reducing or eliminating the 10% core payment for radiotherapy, with the aim of easing the financial burden on cancer patients. Additionally, while chemotherapy is currently provided in Rwanda with the support of partners in health, the government, together with the Rwanda Social Security Board, is working on an agreement to include chemotherapy coverage in the cancer care package. We have initiated the necessary steps and are now focusing on implementation.
Despite the availability of basic cancer treatment services in Rwanda, some patients still seek treatment abroad for several reasons. One key factor is the need for a positron emission tomography, known as PET scan, an imaging test that provides detailed insights into the metabolic or biomedical function of tissues and organs. Additionally, patients may seek advanced care for more comprehensive diagnosis and treatment, as well as access to specialized expertise not currently available in Rwanda, such as hematology and transplantation for blood cancers. Experts in cancer treatment emphasize the importance of collaboration among all parties, namely patients, doctors, and the government, to effectively reduce cancer mortality rates. According to the World Health Organization, cancer causes over 9 million deaths worldwide each year. In Rwanda, cancer cases have been on the rise. From 2018 to 2019, the number of new patients increased from 3,270 to 4,984. Although there was a slight decrease to 4,850 in 2020, numbers have continued to climb since then, with 5,215 new cases in 2021 and 5,263 in 2022. Each year, approximately 1,000 people die from cancer in hospitals. Olive Nete, RTV News.